My interest and journey in pediatrics really started because I just love playing around with children. I help look after my youngest sister, who's 11 years my junior, and I just really enjoyed kind of being around children and playing with kids and watching them grow. So they're just so joyful to be around. And when I did medicine, pediatrics was always going to be what I wanted to do. So my journey in pediatrics started when I was a medical student, and I just pursued that from internship onwards. So I went straight into pediatrics after finishing my internship. So, and it still remains a joy to be looking after children. If you're a young professional starting your career in pediatrics, you really should love your job. And if you love your job, nothing really becomes a chore. And you should always really try and do your best for the child and for the family and for the patient in front of you. And I bet you'll be very rewarded if you enjoy your work, and the patients will all enjoy kind of being your patients as well, and the families are usually very thankful for everything we do for them. So work hard, be patient with yourself, and just enjoy what you're doing. That would be my secret to a nice, long, fruitful career in pediatrics. I am a part researcher and part clinician. And I suppose I should add that one of the things that probably prolong longevity in pediatrics as well is doing research, because it's only through research that you change things on a global scale, on a bigger scale. So you definitely do well for your patients on the individual level, but if you want to change things, you really have to look at it outside the box and then do research. So at the moment, as a pediatric respiratory physician, my research projects are based on trying to improve the lung health of children, because we know that lung health of children determines their lung health as adults, and not only that, it also determines their future morbidity and mortality, and increasingly there is data showing that. So my projects really can be divided into several categories. I've got projects looking at trying to prevent respiratory infections, and those projects include using maternal vaccination, and also using what we call prophylactic antibiotics to try and prevent recurrent bacterial bronchitis, and therefore to prevent bronchiectasis. So that's the prevention component. And then I also have projects looking at trying to improve the management of preschool wheeze, as well as pediatric asthma in the clinical sense, by using a wheeze meter to enable parents to actually detect wheeze better. And so we're looking at using that to improve the management of preschool wheeze, asthma, as well as reducing hospitalizations and recurrent visits to doctors for that. And then I also have projects looking at improving the management of bronchiectasis, and we're doing several projects there, which are kind of interventions to reduce the flare-ups or exacerbations of bronchiectasis. So, and then on top of all that, it's important when you do research, you actually have implementation arm as well. So you actually do the education on top of the research that you do, and involve parents and patients, or what we call consumers, and the public. So my research spans quite a broad area, and obviously I don't do research on my own. I'm very lucky to work with a whole team of people in my team, as well as collaborators both in Australia and internationally. I'm very excited to be able to present at the EAPS 2025 because I will be talking about the clinical practice management of children with bronchiectasis. People still think that bronchiectasis is irreversible and will go downhill, But I've been doing work on bronchiectasis for 20 over years now, and we know that if kids are diagnosed early and managed optimally, their bronchiectasis is totally reversible. So it is a condition that is reversible, and you manage them well using clinical practice guidelines. The parents really would thank you because their cough goes away, and you end up with patients with normal lung function as adults. If you don't treat their bronchiectasis well, what happens is the lung function declines, they get recurrent exacerbations, and they end up with adults with more severe bronchiectasis. So my presentation, and thank you to EAPS for inviting me, is to talk about the evidence-based management of bronchiectasis in children and adolescents. So I'm very excited to be there. Uniting care and having collaborations across multidisciplines is absolutely essential to improving almost anything we do. So in the talk that I will be giving, that's based on our clinical practice guidelines, it is a collaboration between respiratory physicians, general practitioners, radiologists, and physiotherapists and nurses as well, because in a condition, any condition, often it crosses disciplines, and the clinical practice guideline that we produce involve them because, for example, with bronchiectasis, you need to diagnose it earlier, so you need the radiologist to be on board. Airway clearance is an essential part of bronchiectasis, so you need physiotherapists involved. We need nurses who can advocate for the patients and help look after their care. And obviously, we need primary care on top of tertiary care as well. But no matter what discipline you have, at least in chronic diseases, you definitely need cross collaboration with a whole lot of not just medical cross collaboration, but also collaboration with allied health and nurses. I am very excited for the upcoming Congress because I have a chance to present what I think is really important for general pediatrics to the wider community. So I usually only attend respiratory conferences. So I'm excited to present data that I hope general pediatricians will find it useful. But I'm also very excited to be able to learn from the conference because I don't attend a lot of general pediatric conferences. So the last one I attended was several years ago, and I definitely learned from it as well. So I'm excited to learn as well as to talk about bronchiectasis because it's really important that the general pediatricians know about the importance of chronic red cough in children, so you can actually manage them better, improve their outcomes, and also improve the quality of life of the children and their families. My message to the pediatric community, with respect to my presentation anyway, is that you have to take chronic cough in children seriously. Listen to the parents, their burden and their quality of life impairment to them and to the child is very real, even though doctors often just pat them on the head and say the cough will go away. So take it seriously, and it will make a big difference to their quality of life as well as to their future outcomes in health and well-being.